You know that feeling, right? You bend down to pick something up, and bam, that sudden, unwelcome twinge in your back. Or maybe you stand up after a long day at your desk and just feel stiff and sore. If any of that sounds familiar, trust me, you are in very good company. But what if all that pain wasn't just random? What if we could actually decode what our back is trying to tell us?
Okay, let me just hit you with this number right away. A full 80% of adults will deal with significant back pain at some point in their lives. I mean, think about that. That's 4 out of every 5 people you know. So it's really not a matter of if, it's a matter of when, which makes understanding it so important.
You see, that ache, that stiffness, that sharp jab of pain, it's not random noise. It's a signal. It's basically your body's check engine light flashing. So in this explainer, we're going to pop the hood, we're going to break down those signals so you can finally understand the message, know when you should actually worry, and learn exactly how to respond.
All right, first things first. Let's try to figure out where this pain is actually coming from. And I've got some good news for you right off the bat. For the vast majority of people, the cause is way less scary than you might be imagining.
Now, take a look at this chart. This is so important because it immediately puts things in perspective. A whopping 85% of all back pain is what we call mechanical. We're not talking about some serious underlying disease here. We're talking about everyday wear and tear on the structures of your back. Only a small sliver is related to more complex stuff with discs or nerves.
So what does mechanical actually mean? Well, it's the day-to-day stuff. It's lifting that heavy box with your back instead of your legs. It's slouching over a laptop for hours and hours. It could even be something as simple as sleeping on a worn-out mattress. It's these small, repeated stresses that add up and become the #1 cause of that ache we all know.
Okay, so for that next 10%, we are looking at issues with the structures inside the spine. A herniated disc, for example. Just picture a jelly donut. If you squeeze it too hard, the jelly can bulge out. That's kind of what happens, and that bulge can press on a nearby nerve, which can then cause issues like sciatica. That's that sharp, shooting pain that can travel all the way down your leg. Okay, everybody, listen up, because this is probably the most important part of this entire explainer. How do you know if your back pain is a simple strain you can handle at home, or if it's something that needs a doctor's attention, like right now? Let's break this down very carefully. Over on the left, these are the serious red flags. These are the don't wait, go see a doctor signs. Things like loss of bladder or bowel control, significant numbness around your groin area, or a sudden new weakness in your legs. Also, if you have severe pain right after a fall, or if your back pain comes with a fever. Now, these are rare, but you cannot ignore them. Okay, now look at the right. This is the much more common scenario. This is the dull ache after you overdid it in the garden, the stiffness from sitting too long, the general soreness that feels better when you rest. Knowing the difference here is absolutely everything. So you've looked at the guide and your pain falls squarely into that home care category. Fantastic. Now what? Let's get right into your immediate action plan to start feeling better fast.
Here is your simple 3-step routine. First, for the first day or two, use ice. Cold helps shrink the blood vessels, which reduces inflammation and swelling. After about 48 hours, switch to heat. A heating pad can help relax those tight muscles and get the blood flowing. Second, and this is so important, avoid just lying in bed all day. Gentle movement, even just a few short walks, is crucial. It keeps everything from seizing up. And third, over-the-counter anti-inflammatories like ibuprofen can really help, but of course, always use them as directed.
But what if you've done all this for a week or two and that nagging pain just isn't getting better? Well, that's your cue. It's time to call in the experts. A physiotherapist is going to be your best friend for creating a structured plan to not only heal the current problem, but to stop it from coming back again.
All right, we've dealt with the immediate pain. We've put out the fire. Now let's get to the most powerful part, prevention. How do we build a back that is strong, flexible, and just resilient to future pain?
The long-term solution really comes down to these simple, consistent habits. I want you to think about strengthening your core muscles like building a natural corset for your body. It's a support system that protects your spine, and when that corset is strong, everything else, from your posture to how you lift things, gets easier and so much safer. So, what does this actually look like day to day? Let's look at 3 essential moves you can do. First up, the cat-cow stretch. This isn't about power or pushing yourself, it's about gently waking your spine up. As you flow between these 2 positions, you're helping circulation get to your spinal discs and basically unlocking stiffness, one little piece at a time.
Next up is the bridge pose.
And here's a little secret for you. The best back exercises often aren't back exercises at all. This move strengthens your glutes and your core. Those are the big, powerful muscles that are supposed to be doing the heavy lifting. When they're strong, they take all that pressure off the smaller, more delicate muscles in your lower back. A strong foundation here changes everything.
And finally, the modified plank. Think of this as building your own internal back brace. By just holding this position, you're training those deep abdominal muscles to fire up and protect your spine automatically. The trick is just to keep a nice straight line from your head to your knees and really pull your abs in to stop your lower back from sagging.
Now, while we're building this amazing physical support system, there's one last piece of the puzzle we just can't ignore. Your mind and your back are deeply, deeply connected. When you're stressed out or anxious, your body tenses up. Your muscles get tight, especially in your back and neck. And that can both create new pain and make any pain you already have feel so much worse.
So the bottom line is this: your back is always communicating with you. By learning its signals, knowing the difference between a simple ache and a red flag, and building a foundation of strength and good habits, you can completely change that conversation. So I'll leave you with this question. What's one small thing, maybe a 5-minute walk, a simple stretch, or just adjusting your chair? What's one thing you can do today to start building a healthier back for all your tomorrows?